Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm excellent. How are you?
You're as gorgeous as ever.
Oh, you're so too sweet, too kind.
I do my best, you know.
Yes,
we got to all stay happy.
That's right. So, how are we going to help our listeners today?
Well, I think today will be an amazing day, amazing show. And we're going to teach people how to save themselves from having an orthopedic surgery that is not necessary. This is not a statement against surgeons. It's a statement against all of the surgeries that are done that, in my humble opinion, should not be done. I'm just one guy, but I've been doing this work over 25 years of regenerative medicine, which means that we're here to regrow cells and tissue in the body instead of cut them out. And I learned about this, back in medical school after a failed surgery on my shoulder. And then after a few years of misery, I learned and I had the experience of my wrist healing overnight with a simple shot of prolotherapy. That's the old term. And it's now morphed into PRP, platelet-rich plasma, and stem cells. And I was better overnight. I then self-injected my shoulder, which had the failed surgery, got better overnight. And since those days, I've injured my knees. I've used platelets and stem cells on those. My shoulders did the same. I've worked on my elbows. I've had my friends do my neck and my back when I've injured that. And all in all, I've been doing amazing. And it's a technique that I think people should look into because it's so conservative and easy. You walk in the office, you get an injection, and you walk out instead of going to a hospital or a surgery center for a surgery that has, because of its invasiveness, has potential for all kinds of negative things. We call them sequelae in medicine. I've seen endless infections. I've seen joint replacements that have come loose. I've seen a couple of people die on the table during surgery from anesthesia. So although it is needed in many occasions, in most, relatively, percentage-wise, I think it's a lot better, a lot safer to use what we call, oh, look at this. We have a caller coming in. Hang on one second. I'll finish up. This is Ruthie.
Okay.
I think it's a lot simpler, more effective in most cases to use cells from your body, your platelets, or your stem cells to re-heal the area again instead of using a knife. So, Ruthie, this is Dr. Marc Darrow. You're from Sherman Oaks, and you have issues with your knee and back. Tell us what's going on, and thank you for calling in.
Yeah, I just wanted to, say kudos and definitely my knee and my back have definitely helped me with the PRP so much. And, everything you're saying is like right spot on, because I just didn't want to do surgery and I'm scared of all what you're talking about, all the repercussions and issues and problems that can go on. So many of my friends have had surgeries that didn't really work or they had other problems. And so, just doing this non-invasive thing is the way to go, and it's really helped me a lot. And, I run a lot. I run on trails and I swim and, I'm pretty active. I cycle and, I was really kind of having to scale back all that stuff and it was making me nuts. But it's just, I'm so glad that I've discovered PRP because it's enabled me to just keep up with all my activities. And, I'm in my late 50s now and everyone tells me, oh, because your age, you're going to have to slow down, and I don't want to slow down. So I found a way
I'm
to
75. I'm 75, and I don't want to slow down either. And I'm like you. I mean, I've had so many injuries from doing sports, and
Yeah.
I've had good luck every single time I've self-injected myself. And people go, well, you're crazy. How could you inject yourself? And actually, you're in the nursing field, aren't you?
Yeah, yeah. I'm just finishing up nursing school, and so yeah.
So I will show you how to inject yourself, and then you won't have to come in and see me anymore.
Wow, that would be cool.
No, I mean, a lot of people think it's crazy that a person can inject themselves, but it really is not a big deal. It's easy. For me, I feel better injecting myself. I feel safer doing that than having someone else do it. And the nice thing about it is you do it exactly the way you want to do it instead of the way someone else wants to do it. So if you ever want to come in the office, I'll be glad to teach you how to do these kind of things, and it may be part of what your nursing practice turns out to be. You don't know.
Cool. Yeah, I'd love that.
When do you think you'll be finishing nursing school?
By the end of the year.
Amazing. Yeah. Anytime if you have free time, you can come in, and I will be happy to mentor you and show you, how to take the blood. Well, you already probably know how to do that, but how to spin it the proper way, and how to do injections. I mean, it's not that hard. It takes a little guts in the beginning because it's kind of a weird thing to, I was watching Peaky Blinders last night. You know what that is? It's an episodic on TV about an Irish gang that comes down to England. And there was a character that was about to commit suicide, and he was putting a gun to his head. And I'm thinking, boy, that must really take guts, to do something like that. But then people think me injecting myself is like that, but it isn't. It's not really difficult to self-inject. And the nice thing about it is I don't have to go to any other doctor to get injections. When I get injured, I can just do it myself. And I don't know, have you had any training yet on using ultrasound to look inside the body?
Yeah, we have.
Well, that's good. And I think it's really important for people to hear about this because ultrasound is, it's been around for ages for, looking to see if you're pregnant and how many babies or embryos are in there and other things. But now it's being used very widely instead of x-rays and MRIs for a lot of conditions. And I use it to guide the needle. So when I'm injecting myself or my patients, I'll put the probe down in the area and I can see where that needle is actually going so I can get it into the exact spot. And I can show you how to do that with needles also if you want to learn how to do that. I love training people. I have students with me all the time. And we do research. If you ever want to get involved with research, we have a lot of projects going on. And that helps. Cool. I don't know if you're going to go on to become a nurse practitioner. I would advise you to do that. But
that'd be great.
Then you can.
Yeah, I would love that. I mean, it's definitely something to learn because the needles I know are a little bit longer than what I'm used to using. But you also, I mean, the other thing is too what you're saying about injuries and stuff. I mean, I feel like this has kind of lowered my stress levels, if you will, like about getting injured or about like the wear and the tear, because I know that, I have sort of a solution for it, and so it's been great, like kind of freeing up, I just feel better and stronger on my runs, and it's just a great psychological uplift too,
Well, amazing. Thank you so much, Ruthie, for calling in.
Thank you.
Again, you're welcome to call my office anytime at 800-300-9300. And you can come in, and I'm very happy to train you and get you on to, I don't know exactly what you will end up doing as a nurse or hopefully eventually as a nurse practitioner. But nurse practitioners can have their own practices now, and they don't even need a doctor to oversee them. So I think this is a great tool in the woodshed, you might say, for healing people that have musculoskeletal issues. And I've been doing it over 25 years with amazing success. And if you're interested in doing that, Ruthie, I think it'd be great for you to learn how to do it. So I'm going to give out the phone number to call in the studio right now. That's 866-870-5752. You can talk to me live, just like Ruthie just did. We love our callers. And if you call in, you get a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's a 200-page book, It's got about 250 studies on it, on platelets, and that's PRP, platelet-rich plasma, and stem cells, and how you can help your body heal without a surgery. Now, again, I have to say this, it's a caveat. I don't like a lot of these surgeries, these meniscal tear surgeries and rotator cuff surgeries and labral tear surgeries, because I see way too many people come out bad. But it's not a statement against the surgeons, because doing the surgery is not easy. And there's a lot of the surgeries that do need to be done, especially if someone has something like a fracture where the bones need to be put back together. I'm all for that. I'm not for these other surgeries, though, because I see way too many failures. And I do understand that the people that come to me are the ones that have had the failures, but it kind of gives me a jaundiced eye about surgery. So at any rate, give me a call right now. I'd love to talk to you, and you'll get a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, and I'll even pay the postage. The phone number here right now to call me and speak to me live is 866-870-5752. I'm going to repeat it, 866-870-5752. And if you want to get a hold of anybody at the office, we give out free phone consults. It's free. You can call in anytime. Free phone consults at 800-300-9300. Also a great ally for you folks who want to learn about this. And you can watch me do videos of these procedures all over the body. There's probably nowhere in the body I don't inject. And that's www.jointrehab.com. That's www.jointrehab.com. And there's a few other things we do in the office beside the musculoskeletal system. One is we actually stimulate hair on the head to regrow. And that is very simple. It's in my book. There's a chapter on it. And if your hair is thinning, it's for you. If your hair is gone, it's not going to do much good. You'll get some hair growth, but not enough to make you happy. The other thing that we do is called the vampire facelift. You won't forget that one. And that's where we use the same cells that we use in the musculoskeletal system to regrow the tissue into the face. So as we age, the collagen dries out and we get a little more gaunt looking, or we get wrinkly. And using these techniques in the face with the vampire facelift can actually help you grow back some of the collagen in your face and look younger immediately. So that's a great thing. Nita, anything for you to add here?
Well, yeah, I just really want people to call and get the free book, because it's an amazing piece of work that it took you 5 years. And we're at 866-870-5752 right here in the studio. And the book is amazing. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And Suzanne Summers wrote the foreword, and she wrote a book called A New Way to Age. And you're in her book like 14 pages or something. There's a whole big section on you.
Well, I've been very fortunate to be good friends with Suzanne. I met her through treating her son Bruce, who was an avid bicycle racer at the time. And he ended up on his body a lot of times on the road. And at the time he was living next door to me. So he would just pop in every once in a while after an injury, and he would lay on the floor and I would inject him and get him better. And then I met Suzanne, and then I treated her, and I've treated her grandkids, and we've got a great relationship. And she loves this kind of work. And Suzanne is an amazing person in terms of getting natural medicine out to the public. And she's written about 20 books about natural healing. So God bless you, Suzanne Summers. Thank you so much. And her books have ended up sending, and when people read them, they come in to see me. So it's been a great thing to educate people on how to save themselves from getting surgery. Because although surgery is a way to try to heal the body, to me, it's a very crude way that has way too many side effects and too many failures. And the nice thing about what I do with platelets and stem cells in regenerative medicine is if it doesn't work on you, there's no harm, there's no foul. And the reasons it doesn't work typically is because people are too active afterwards. I get so many sports addicts that they get injected and they go right back to their sport, and then they don't give it a chance to heal. Another reason is they go to a bad doc. That's somebody who doesn't know what they're doing, somebody who doesn't use the ultrasound to guide the needle, and someone who doesn't do it all day long like I do. And then another major reason for failure is not enough treatments. People come in and they'll get a treatment and then they'll come back in a couple weeks and say it didn't work. Well, it doesn't. Tissue growing is not something that happens overnight. I mean, it does happen overnight, but it's not enough sometimes to get the pain gone. So you've got to do enough of it. I never know ahead of time how many treatments it will be. So that's something that some people don't want to get involved with. They go, I'll just get surgery. That's one treatment. I see so many people that have had surgeries that have to go back and have more surgeries, or they're crippled afterwards. So don't think surgery is a way out of your pain. It may be, and it may not be, just like any other healing modality. Unfortunately, laymen think that doctors are saints, and some are, some aren't. But all we do is we do what we think works, and sometimes it doesn't. So I should go to some questions here now till we get some callers.
Okay, do you want to give the phone number again?
How did you know that? Get your pencil and paper, 866-870-5752. I would love to speak to you and see how we can help heal your musculoskeletal pain. All right, so this one says spinal canal narrowing. Let me read this. This came in on an email. And by the way, if you go to my website, www.jointrehab.com, not only can you watch videos there of me doing these procedures, but there's a slot on every single page to email me. And I get emails all day and all night long. So, and I answer all of them. So this one says, my wife's MRI for back pain showed L3-4, that's lumbar, lower back, central disc extrusion. That means some of the disc material, which is the cushion between the vertebrae, has popped out, causing spinal canal narrowing. Is this something that might benefit from a treatment you provide? She has neuropathy in feet for years. Please respond to this email. I've been listening to you on the radio for many, many years. And yeah, I've been doing this show for, I think, 21 years now, since my twins were born, and they just graduated college.
That's right.
Yeah.
Congratulations.
Yeah, it's a lot of fun. They're going back to school, so they're not done grad school. At any rate, let me talk about this. This is very complex. Number one, just because someone has spinal stenosis or spinal canal narrowing does not mean they have pain in their back or pain down their legs or neuropathy in their feet. Those are all different things. And unfortunately, way too many people have surgeons that don't even touch the body part to operate. And that is a real crime in my book. The first thing I do is touch the body, find out where the pain is coming from. And unfortunately, I see people all the time that have had a surgery that failed because the doctor didn't touch them to examine them. They looked at an MRI or an X-ray or CT scan. And this is that kind of a case. There's so many possibilities for what is going on here. This person is having some back pain, but at the same time, they're having neuropathy in their feet. Is that related? It may be or it may not be. There are people that have neuropathy, which means that there is nerve damage, which can be from many things. The top two reasons are diabetes and alcohol. Okay, those are the top two. But it could be chemical, it could be chemotherapy, things like that can cause neuropathy. Now that has nothing to do with an MRI showing L3-4 central disc extrusion. So get that clear. You've got to really do a good diagnosis to find out where is this stuff being generated from. It's not where does the MRI show. There's way too many surgeries that are done for MRIs, but then the people don't get better because it wasn't the problem. So if we were to do MRIs on 100 people, we would find 100 different problems, but those people didn't have any pain to begin with. So what's the problem? There's no problem. but the MRI shows a problem. So please don't get snookered into a surgery because your image shows something wrong. It may not be the proper thing. It may not be the thing that's causing your pain. So I don't know the answer for this person. The first thing I would do with them is I would do a physical examination. I would touch the body, find out where the pain is coming from, and then if there's a neuropathy, I would have them do what is called an EMG, nerve conduction study. That's an electromyogram and a nerve conduction study, and find out where those paresthesias or funny feelings in the feet or numbness is coming from. Is it coming from the feet? Is it coming from the back? Could it be coming from the neck? All those things are possible. We don't know until we find out. So please don't jump and get a surgery to fix that disc extrusion, because I've seen lots of disc extrusions where people get better. And when you have what's called a radiculopathy, like a sciatica, or pain down the arms or legs, and a doctor says it's coming from your neck or your back, that may not be the truth. It could be a carpal tunnel syndrome. It could be all kinds of nerve impingements, and some of those can be remedied. I just did one yesterday. A woman came in, and she had a number of things that were bothering her, and I used what's called D5W, which is dextrose 5% in water, and I injected her carpal tunnel under ultrasound guidance. I'm going to call her today and see how she's doing. Most doctors use a steroid, like a cortisone, to shrink the nerve. She didn't want to do that, so we used D5W, which can actually heal the nerve. And I'm excited to find out. And by the way, I do follow up with my patients. All my patients get called after treatments. And every one of my patients has my cell number, my personal cell number, and my personal email address, because I like to stay close in touch and find out how they are doing. So I'm going to give out the phone number again. And I love when you stump me with your questions. You can talk about your friends or your family, and you can pretend it's not you that has the issue if you're shy. So the phone number to talk to me right now is 866-870-5752, or you can get a free phone consult at the office with my staff at 800-300-9300. That's at the office at 800-300-9300. You can also email me at the website www.jointrehab.com. So, Nita, I'm going to go to a knee instability question here, if you don't mind.
Works for me.
All right. And speaking of instability, you had instability and pain in your neck years ago, and we fixed that with the old style prolotherapy.
Yes, and it's
and
funny.
You're doing good now?
Yeah, that area is doing good, but I might have to come see you. Funny you mentioned knees.
Okay, yeah, you're always welcome. Okay, so this says, "Hi guys, my name is," I won't say it. "I'm a 60-year-old male retired after 32 years in fire service. I have a left ACL tear," that's the anterior cruciate ligament tear that holds the knee together, holds the tibia to the femur, repaired in 2002. Now while playing plant and pivot sports, both of my knees are shifting or they seem loose. Will PRP give my knees stability? Most likely yes, and the best story about it is my knee, my left knee. It's a story I tell almost every time on my radio shows and when I speak to the public or doctors, because I love my doggy Dakota. He's a husky, and he's getting on in years. He can hardly walk anymore, but he's as sweet as ever and funny as ever. A little crotchety. He's close to 14, which in dog years is how much, Nita?
Oh, gosh, I have no idea.
It's
I'm
like
not a math major. I'm a shrink.
He's close to 100 years old in dog years, but he's still great. At any rate, years ago, Dakota and I were at the dog park. He loved running. He still does, actually. Sometimes I take him out for a little walk. He can't go far. And he'll bolt out the door, and then he just collapses. But he still has that running in him. Anyway, he was running full speed in the dog park, and I didn't see him coming, and he hit the outside of my left knee. And hang with us, everybody. We're going to go to the break. I'm going to give you the phone number to talk to me live. It's 866-870-5752. 5752. And the website is www.jointrehab.com. And my office phone is 800-300-9300.
Good job. This is Living Pain-Free with Dr. Marc Darrow. I'm Nita Valens, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.